Welcome to Power CEOs, the truth behind the business. I'm Jen Gaudet, your fearless host, entrepreneur, investor, and business strategist. Why are we here? Because iron sharpens iron. And when we bring experts in their field, really high-powered investors and entrepreneurs, and share what's working in business and maybe some of what's not, what we are able to do is learn and grow. As a result, we sustain that positive momentum that grows our business. And the ripple effect impacts not only ourselves and our families, but also our teams, their families, our communities, and our world. You are in for a treat today. I have two amazing guests here in studio with me, and we are going to dive into all kinds of fun topics revolving around burnout. How do I manage my energy? What do I need to do so that I can show up powerfully for my business, grow my business? What are the considerations for cost containment and looking at benefits for my employees, and so much more. But without further ado, I'm going to introduce you to Dr. Rao. She is the founder of her own direct patient care, direct family practice clinic, and she is an expert in overcoming burnout and in improving energy management. Welcome to the studio, Dr. Rao.
Thank you, Jen. Glad to be here.
I can't wait for this conversation because you and I were talking before we went live on how do you do all the things. You're a physician, you own your own practice, so you're an entrepreneur, so you're in direct care, you're an entrepreneur, and you're a busy mom. How does that happen? How are you able to handle all of those things and still look as amazing as you do here on screen?
Well, it took a few years to learn strategies and place strategies, tell myself it's okay if I don't get certain things done, prioritize. It's a learning curve. It's a learning curve, and it does take time. It's not done overnight.
It's not done overnight. So I want to know what the secret sauce is. How do you manage your time? I mean, we talked about boundaries. What are some of the first things let's talk about female entrepreneurs. What are some of the first things that we as female entrepreneurs, particularly in healthcare, but any entrepreneur need to consider in order to be able to avoid mom guilt and to fulfill ourselves on our personal side as well as show up for our business?
Yes, this is the constant battle. I always tell my husband and my mom, I'm like, okay, there are days where I want to be the entrepreneur, CEO, the boss, physician. And there are some days where I just feel like, okay, today I want to just pretend like I'm a housewife. I want to clean the house and do that. And I think it took me some time to get comfortable with the idea of wearing different hats and doing different things. Like, okay, I'm like doing a meeting, now I have an office at home. There are certain days I wish I want to spend at home and not at the office. So I schedule the time. And sometimes just being at home and even working from home gives you that effect of relaxation. Always being for the important parts of my kids. My kids are 10 and 12. I have two lovely boys, and they know Meridian Springs, and they try to change our title to, we say Meridian Springs think Netflix for healthcare, but then they're like, okay, make it YouTube for healthcare, because they like YouTube. So I think for me it is satisfaction. It is satisfaction, my happiness, my contentment with life, and to try to deal with any frustrations I have. I go back. I've learned to go back and look at what makes me unhappy and try to deal with it. So if in the work setting, there are a lot of things. There are 100 things that come up.
Oh my gosh, every day.
It's constantly making you unhappy. It's like, okay, I've got to deal with this. Okay, this is one project. And everything becomes a big deal at work because things change rapidly. You've got to put new things in place, and everything has to happen quite immediately. So prioritization, delegating work, and also kind of keeping, sometimes I do things with the kids in the bedroom, and we have to get used to that idea that, being an entrepreneur and having my own business, the business and work life, the work life and the personal life flows together. So it's just to make that happen, and it's okay. It's okay to work at home, it's okay to take calls, and not really separate it out too much. And the same thing with the kids. Like if they have something going on, I take a break in the middle of my work day, go there, take care of it. And I think it took me some time to get used to this idea.
And society doesn't train us to take time for ourselves at all as women, really. We're
Yes.
expected to provide for everyone. We're taking care of the kids, we're taking care of the household, we're taking care of everything. And then now we're entrepreneurs or we're caregivers. You and I both come from the healthcare profession. You're a doctor, so you're treating patients and you're constantly caregiving. So to my entrepreneurs who are caregivers, because there's a large population.
It is.
How do they prevent compassion fatigue, caregiving fatigue when they own their practice, continue to practice, see, and then, we don't want to come home and not have anything left in the tank for our family?
I sense that, and that set in about 3 years after starting my business, my clinic, my practice. And I sense that after the initial elation of starting your own business is over, and now you're in the growth phase, and your old job is gone. So you have to perform to see a good return. So, and I sense that the first thing is realization. So you have to be tuned into yourself to realize that you're getting fatigued. And once you identify the symptoms of that compassion fatigue, I love that. I experience that all the time. And I know it. Say if my last vacation was December, and my vacation means I'm out of the city, out of my environment, and that's when I feel like I'm truly disconnected. Even though I'm on call, I may look at my messages and all that. So now it's April, and I sense it. I sense it that I have not planned my next vacation. That compassion fatigue sets in, and it's very important to treat it immediately. Take a break. Now, if I can't take a 4-day vacation now, what I do is I take a half day off. I kind of like go for a massage or spend some time. Sometimes if I'm exhausted, I just don't do anything. I just lie on the floor and stare at the ceiling and just tell myself that, okay, I'm just going to roll over, stretch myself, and not do anything for 3 hours.
I think that's fantastic. And I want to just highlight this, because if you missed what she said, it's the realization that we're into that compassion fatigue or that burnout or that excessive fatigue state. First step is awareness. And when we become aware, then we can start to think back of, okay, what triggered this? What am I not doing in my day?
Yes.
How am I not fueling myself and taking care of myself? And you take your break, you plan your vacation. But then once you do that, I'm really curious, because I always look at it internally myself too, and I'm a coach, so I work with a lot of entrepreneurs, and I say, when you get to that level, plan your vacation, get your getaway, but what is the one habit you're going to change so that it's a longer time period before you feel that your tank is empty? How do you keep fueling up that tank a little bit more each day? Do you do the same?
Yes, it's very important to get to that point and not let it go past that. The initial time when you realize that there is a fatigue setting in is that start taking small breaks, pace yourself. It's okay if you don't check so I'm a physician, I get messages all the time, and I've trained myself not to look at the phone when it rings instantly. So my ringer is usually off. I check in messages once in 30 minutes or an hour, and weekends little bit longer. But it's very important that you're not constantly thinking of, okay, my phone is going to buzz this moment and I need to act on it immediately. Oftentimes you don't have to act on it immediately. And that's something I had to train myself out of, responding to those sounds, those beeps and pages that you get. And that's very important for healthcare professionals.
Absolutely. I couldn't agree with you more. And it's like, that's once again a boundary. It's a boundary that we set.
Yes.
I do not have to be accessible 24 hours a day, 7 days a week, even though we have telemedicine and chat functions. And I don't have to respond to that immediately. And you know what I do? Now I'm no longer in medicine. I'm now in the coaching world, but everyone has access to me in the case of emergency, because emergencies happen in business as well.
Yes.
Oh, you were just slapped with a lawsuit. It might be frivolous. It might not. You have this problem. What is an emergency to you might or might not be an emergency to me. So I set the clear expectation in the beginning, and I say, listen, this is an emergency.
Yes.
If you have an emergency, this is your path of action. And for me, it's not phone call. It's you text, but you text 2 separate texts. So I get 2 notifications, and it's and that's my, oh, I need to look at this.
Yes.
Cue, right? So like, how do you train yourself, your staff, your teams? Because we're caregivers and we want to do that. Like, what does that look like? How can our viewers start that process today?
So as a business, we have auto messaging. So there's an auto response sent out to patients on, especially on holidays. Like if there's a July 4th coming up, I set an auto response for that weekend. I may be still looking at messages because, say, sometimes it's difficult to break the habit, but you don't have to get out of what you're doing to go to a laptop and actually work on it. So there is a difference between looking at it, registering it, like, okay, let me get back to this, that's fine, you know, put it away. It's a, probably for, in my world, it's like a medication refill, which is not an urgent response thing, it's like a next day thing. But I think for everybody, some emails, some things, you can look at it, but you don't have to respond and react to that. That's also a boundary, that you don't have to leave. Say if you're playing outside or spending time with your family, you don't have to leave all that and come in, do the work of logging into your work and taking care of it. That's also a small boundary to set for yourself.
I really like it. I like the small steps, the small changes.
Steps, yeah.
And you know, it's kind of like habits, right? They stack on one another. So if we make one small change, then we just get comfortable there. Then it's the next small change. And over time, as you stack those, it actually becomes a very big change. And we have that energy reclaimed.
Yes. So it's like again, it's like you're collecting that fatigue. And the more you collect, the difficult to disseminate. So you may have a vacation plan, but if you're fatigued and exhausted in that vacation, you're not going to enjoy it, and then you're going to come back saying, oh, it's done, I didn't even have fun. So I feel like our goals should be that let it not accumulate and affect you to that extent. You need to take action on it before that happens.
I love it. Awareness, change the habit, take action. Thank you so much. We do have to take a brief break, but the good news is we will be right back after these messages. Welcome back to Power CEO's Truth Behind the Business. If you're just tuning in, man, have you missed an amazing first segment. We talked all about compassion fatigue, burnout, energy management, setting impactful boundaries in business. And now we're going to shift gears a little bit because I have a power duo in studio today. And I want to introduce you to the other side of that duo. I have Sunil here, and Sunil is an expert in helping you with cost containment, specifically in the healthcare benefits sector. Welcome to the studio, Sunil.
Thanks for having me, Jen.
So Sunil, we were talking about this in the break. One of the biggest challenges, especially right now in business, is managing our operating expenses.
Right.
And one of those expenses that are completely out of our control, we never know what's going to happen and always grows, is our healthcare costs.
It is.
And the benefits that we offer our employees. How do we solve this problem?
It's a big problem. So according to the statistics that I've seen, healthcare expense for an employer is the second or the third biggest cost. And I think from some of those auto companies, it's actually the biggest cost. For Starbucks, they spend more on healthcare than on coffee. Right? That's a statistic. So, and it's also not just, it's big, it's unoptimized. Because healthcare cost is like a black hole. Nobody wants to look into it, and therefore it's a big problem. And once you solve the problem, you're not only bringing quality healthcare, you're also saving a lot of those healthcare dollars, which I call waste, which could be invested in R&D or used for any useful things rather than waste on healthcare spending. So there are a lot of ways that healthcare could be optimized for an employer. And what I want to kind of talk about first is a big picture view of where the money is going in the insurance.
Oh, wait, if you can enlighten us on that, then we're definitely getting somewhere.
Yes.
Because it is a black hole. I feel
It
like
is.
the premiums, you just pay and pay and pay. It's never always utilized. And then all of a sudden next year it goes up.
Yeah. So think of this, right? So you're paying the premium, and there is, again, this is a very simplified version. So it's kind of an account in your name. Let's say there are three places that you can open that account. So with the carrier, with your insurance company, and then outside that. But let's first talk about with your carrier. So any of those big carriers, the insurance companies, when you pay the money, very simplified view, think of it that it's going to be going into an account. It's a pool of money in your name or your company's name that is there. So what the insurance company first does is, of course, they commingle the funds and they do all of that. But for simplicity's sake, what they first do is they pay the claim from the premiums that you pay them. So there's a fixed cost, there's administrative cost and all of those things. So if you remove that, let's say about 80% of or 70% of your premiums that you paid in, that will be in that account that will be used to pay for your doctor, claims. That's the first pool of money that the insurance is going to dip into to pay for your claims. Now, around that, there is a protection, which is kind of a stop loss. There's a reinsurance that is once, let's say if you have over the course of the year, you have about $50,000 into that fund in terms of the total premiums that is in the claims fund. And now an employee has a $200,000 claim for a big procedure or something goes on. There's not enough money in this pool. What happens? So there is a stop loss, which is where actual insurance comes in. So you have to think that the first dollars that even the insurance pays, not the ones that you pay out of pocket, but even the insurance pays, it's actually coming out of your premiums, not coming from insurance, right? And almost 90 to 95% of the time, we do not hit deductibles, which means that whenever the insurance pays the claim, even though we say insurance pays the claim, they're actually paying your money, which is in that account to the doctor, right? So now let's assume that you have hit that a $200,000 claim and you don't have enough funds. That's when the stop loss, that's the reinsurance, actually comes in play, and they're going to put that money in it so to make it full so that they could pay the claim. That's when the insurance is real insurance comes in. Now, you can have that account outside of insurance too, right? People think you need to pay the premium and the account has to be with the insurance. When you pull that account outside and every other part of the insurance, the administration, the 800 number that you call, the prescription claims, everything will be handled by them, and they call it ASO, Administrative Services Only. But then the claims part could be outside the carrier with the TPA, a third-party administrator. So now what happens is you're pulling it out of a black box, and then now you have the funds that you can now look into what this being paid for, what is this used for, and all of that. And it's much more transparent than having it with the carrier. And it's called, when you have it outside, with a TPA, a third-party administrator, it's called self-funded. Basically, you're paying for all the fixed costs and the insurance for the reinsurance that goes to protect your account. But then you hold, or the TPA will hold the control of the claims fund outside. And a good thing about that is because a typical year there's going to be excess fund there, who does that money belong to?
You as the company.
It comes back to you.
And so let me ask you about that, because if we shift that out, we still have stop loss. We still
Correct.
have catastrophic coverage available for our employees. But we are now in charge of this. What other things do we as entrepreneurs have to think about? Is there extra staff that needs to be devoted to this, extra communication when we go to the TPA? What does that look like from a labor standpoint?
No, so it's the TPA and all of those things. When you go for a self-funded, all of this mechanism is already there. So you as an employer do not have to do anything for you. And one of my friends gave a very good analogy, right? It's like, when you wear a watch, all you need to know is time. Whether it's analog, digital, what technologies, finally it comes to, I need to know the time. So even with this, whether it's a fully insured, it's a self-funded or whatever mechanism, what you need is healthcare. When you go to the doctor's office, you get healthcare, the claims are paid, that's all you need. What it is structured like and all of those things, really for the employees, it's not needed, because they're good with getting the healthcare. But for the employer, these things are very good and very necessary to know, because it is the difference between who gets to keep the money at the end, right? If you have an insurance and you don't use it for the whole year, who gets the money at the end of the year?
You.
No, not in the big carrier.
Oh, in the big carrier, they do.
Exactly, right? So,
and you don't even know if it was used.
Exactly. So that's what's going on. So it's not only the fixed cost that they're getting, but the end of the year, when nothing is used, all the premium goes to the carrier. But with self-funded, you get to keep the money or you get to roll over. And there's another interesting mechanism. and that is a fantastic thing for employers. Now it's available for 30, 50 smaller businesses, and it's called captive. And that's a third way of doing it. So we pull the ownership from big insurance to a TPA. Now, what if that is pulled to your own company? So that is how a captive is done. So you as a company, as an employer, you own the insurance company. So think, I mean, it's not even, this is like, wow, can I own my insurance company? Is that legal? Yes, of course you can. Captives have been there for a long time. So a captive is a mechanism where there's a C Corp built, and now you're paying the premiums to that C Corp, and all the ERISA laws and all of those that apply for insurance is applicable, so you cannot dip into those funds and all of that. So that will be there. But all the health plans, the TPAs, and the stop loss around that, all of those, we come in picture. We do all of that stuff for the employer. But the great thing is, at the end of the year, that premiums that's used minus all the claims paid, that is an asset on your balance sheet.
Falls under your EBIT line.
It is there. So that means, and I was speaking to a company that was looking for VC funding, and once you do that, look at when the VC looks at their balance sheet, their insurance that they've paid, let's say over 3-4 years, that's going to be about $2-3 million in that. Of course, assuming that they're not big claims.
You can reinvest these funds because
you cannot reinvest, but you can get a loan on that.
Oh, okay.
So of course you cannot touch the fund, but then you can get a loan on that fund, and then you can pay interest to yourself. I mean, it's kind of like the infinite banking concept,
Yes,
those concepts that's there in the life insurance space. Pretty much the same thing in the health insurance space.
And so just to wrap this up, because this has been a lot of information, and I know you're listening and you're like, holy cow, that's a lot. What do I need to do now? Well, to make it very simple, the way we're handling this with our big insurers is we're losing all of the unclaimed premium to the insurers. We can choose to go to TPA or self-funded and or captive, depending on the size of our business, depending on what we have and our individual circumstances. And now we have those funds either rolled over to the next year, or they come back to us in the TPA. And in the case of captive, we can actually access more funding, which every business needs capital at some point in time. We're always looking for optimization, especially if we're in growth mode. So now we can utilize those dollars that were going to the big companies. Now we have access to that, so we can actually grow our own companies and support our employees in different ways. I think it's fascinating. We do have to take a brief break, Sunil, but I would like you guys to think about this, because I know I encourage you to always reach out to our guests, but start thinking about what questions do you have and reach out to Sunil. Sunil, how can people who are listening or watching reach out to you to learn more about this concept?
Sure. So they can look me up on LinkedIn, Sunil Vasisht, Sunil. Last name is Vasisht. They can email me, sunil@medprime.co, or go to the website, medprime.co, and there's a contact page there. You can just message me there. You can reach out, and I can help you in the employer space or in the primary care space, because we want to fix this healthcare issue in this country.
Yeah, absolutely. Thank you so much. We will be right back after these messages. Welcome back to Power CEOs, Truth Behind the Business. If you're just tuning in, you're going to want to go to nowmedia.tv, click on shows, go to Power CEOs and catch the first half. Why? Because we have talked about energy management, boundaries. How do we set impactful boundaries so that we can have an effective work-life balance, so that we can take care of all the things on the downside, on the life side, as well as in the business. And then we shifted gears and talked about how do we enhance our cost containment? How do we optimize the healthcare costs that we are paying as entrepreneurs and as executives for our teams, and how do we actually bring that under our own purview and maybe even explore captive insurance that falls on our own balance sheet. So I want to immediately dive into that. I am here with Dr. Rao and Sunil. Yes, we are bringing it all together. And I'm going to ask you, Sunil, first. When we talk about captive insurance or self-funded insurance, and And it has this direct primary care component to it. What does it look like from the insurance side and from the employer's point of view as well as the employee?
Sure. So when you put the core of the insurance that we do is direct primary care is the core of that. And then we have the wraparounds where if they have to see, if they have to be hospitalized or they have to see specialists, then they can use the insurance part of it. But everything is built into one. So in terms of the employee experience or the patient experience, it's like the card, any other card that they are already aware of, they already know and have one. But how it's structured is different. So what DPC, direct primary care, does in this health plan is it is going to be, it's called as a tiered insurance plan. So whenever there's a visit to a direct primary care, there's no copays, there's no deductibles, there's no claims. An employee might not be worried about the claims, but for the employer, absorbing the claims, the DPC absorbs all the claims. That means that 10%, 15, 20% year over year increase in the premiums, you will not see those unless there's a bigger claim. So what DPC is doing in a health plan like ours is it's absorbing all the claims, because when you go to a DPC doctor, there's no claims. And nobody's counting how many times you're going, because and there's no deductible. So there's no copays, there's no deductibles, and there's no claim. And that's the incentive that we have built for employees, for people to go to their primary care first, because primary care is primary, right? Once you go there, they can solve 80 to 85% of your problems, health issues. There's no referral required. But then the DPC guys are going to determine, the doctor is going to determine if you need a higher level of care. So in that case, we have built a fantastic way of referral. Because now when your DPC doctor tells you that you need to go see a cardiologist or you need to go see a surgeon, and then you go see the surgeon, your out-of-pocket costs to go see the surgeon or your cardiologist is going to be zero. So that means you don't have to pay any copays, you don't have to pay any deductibles when your DPC doctor refers out. And the reason is, if the DPC doctor refers out, then that referral is the appropriate level of care that is needed. It's not a wasteful care. It's not something that you as a patient has determined that, oh, I got a headache, I need to go to see a surgeon or a neurologist. Because when you go to primary care, then they do a bottoms up. Oh, is that your diet? If it's what is a stress? So when they figured out it is really something to do with a higher level of care, that's when it goes. So the number of referrals that go out is going to be much, much less. And so the incentive to the employee is, if you use this way and you go to that referral, then you don't have to pay anything out of pocket. But then everybody hates constraint, right? This sounds like an HMO. No, it's not HMO is a narrow network. You have a whole of PPO in this insurance. What this does is we incentivize doing the right thing, but if you really want to go to a doctor that he's a family friend of yours, there's no constraint, but then your deductibles, copays, and everything else will apply. So we have built an incentive without the constraints, so that you are free to go wherever you want, but then there's a right way to do, and if you do that, you don't have to pay a dime out of pocket.
And so from the physician standpoint of this, as you work with people in this kind of environment, how does that impact the care side?
It streamlines the care more. We get to we have people utilizing the primary care more. Classic example, if I can tell an example of a case like back pain. We have an employee come in with back pain, maybe in his mind he wants to see a neurosurgeon right away. Now that could lead to a very expensive workup and no outcome. The outcome could be same as me prescribing medications and rest. But what we do in this kind of a case is we get the patient, evaluate, do the workup initially, give him the initial treatments, and then move on to advanced testing, and then move on to a referral if needed, if surgical intervention is needed. This streamlines the diagnosis process and management process, whereas reducing cost and sending him when other options are already done and expended. But we also know that, okay, this is a case that needs surgical referral, send him over there. So this is a very concise example of how this kind of a network works.
And so I'm going to ask about this because this is something that comes up a lot, and I have a background in physical therapy, so we see, I've dealt with it from the insurance side as well, and what we see is employee gets injured on the job, employee wants to be directing their own care. How do we shift from the employee directing their own care to being accepting of this model as an entrepreneur, as the employer?
As the employer. Well, it's again, it's explaining whenever. So it's not about controlling your care. It's about explaining the medical process and the diagnostic steps that take place. So when you go back to the basics of what's recommended and what are the guidelines to follow, it makes sense to everyone that, okay, this may be simple, we do this first, and again assuring the patient that, or the employer, that if this needs escalation, we will do the escalation. We are not saying that we won't do the escalation, but it's a stepwise manner of, basically go back to the evidence-based medicine, go back to explaining what the possible diagnosis could be, from something simple to something very dangerous, and how do you eliminate by doing different tests and different treatments. Maybe they need an X-ray, rest, muscle relaxants, physical therapy. And if nothing works, I've had a patient come in with a headache, gone to 2 other doctors, and he's tried a lot of medications already for like a bad severe headache. I give him 3 days time, we don't give a week's time. After 4 days, I'm ordering his stat MRI, and lo and behold, this patient has brain cancer. So we've seen several examples of just following the evidence-based medicine, following the steps of diagnosis and treatment is going to make a massive difference in the care they get.
And it reduces overutilization as well, because we're not immediately jumping to MRI when maybe all we did was sprain an ankle.
Yes. And it also hastens diagnosis when the doctor has the time to look at what steps have been already achieved and what steps have failed. And this was a very, I saw the patient and within a week I had this diagnosis in my hands. And that was a very fast moving case where this happened. So we have that ability to accelerate and escalate the care needed for that patient.
And imagine if they had gone and booked an appointment with a specialist and hadn't gotten in for 3-4 weeks, they would be 3-4 weeks down the road before they got a diagnosis. And in the case of cancer, that's a time.
Yes.
That's a time to treatment situation. Yes. So actually you're accelerating, you're catching it maybe earlier, or you're accelerating the process, which is ultimately better for our employees, for our people as well.
We have same day access, and that makes a huge difference. As you said, when you want a specialist to see you, they have an appointment 6 weeks out. So you're dealing with this problem for 6 weeks before it reaches a greater magnitude by the time you hit the specialist.
So let me ask you a question. In the account of something that's more acute, that does require specialist care, if they come to you first and you're like, okay, no, you need a cardiologist now because you are having something, or maybe you need to go to emergency or something, do they get in faster because they've gotten in to see you and you've done that workup? Do they see a quicker result as well?
Yes. Most of the specialist offices, even if I don't know them personally, will respond to a primary care, calling them and letting them know that this is the situation, and we get an honest answer that, hey, honestly, I cannot see this person for 4 weeks, or I'm going out on a vacation and I'm not coming back for 3 weeks. So that gives me a right then and there, okay, I'm going to talk to another specialist, get them in immediately, or direct them to the ER if needed. So for this case, the brain cancer case was, I got the the MRI report called in at 5 p.m. We called the patient multiple times, told him this case was uninsured, but we told him that, okay, this is the scenario, get your relative and head to the emergency room. But oftentimes, we can do a lot of things the same day. We can take care of a lot of situations the same day. I have some specialists whom I know very well. So there is ER scenarios and office visit scenarios. So first thing is to differentiate the two. And if it's an office visit scenario, we make sure the patient is safe to wait for a few days. And otherwise, that's a ER call. And that's a valid ER call. It's not a ER call for fever, flu, COVID, headache, those kind of things.
So what I'm hearing is, and we do have to break for commercial, what I'm hearing is what we're doing is we're saving on cost because we have an insurance that covers catastrophic care, and anything that is not used, we are keeping as the employer. So we've had a cost reduction, and we're getting better care for our employees because they're able to see and access. They have improved access to primary care. They get seen and they get a workup done more rapidly, and then they're expedited through the system if they need to be escalated. So it seems to me to be a win-win-win situation. If you're listening to this, if you're watching this right now, I have an action step for you already. Learn about your options. If you are an employer, if you are an entrepreneur, if you have employees, start thinking about what else is out there in the health insurance conversation that you could explore. If you're an employee, start asking the questions. We are as employers, I'm an entrepreneur, I own multiple businesses. I love when people come to me and say, hey, have you learned about this? What if we did this? Because that's opening the door of conversation. We talk about transparency all the time, but the result is better care for less cost. And so it's time for you to educate yourself, learn about that, connect with one of these amazing guests. But we will be right back after these messages. Welcome back to Power CEOs, the truth behind the business. We are super excited about the conversation we are having today. I encourage you to reach out to both Dr. Rao and Sunil to learn more about this, because as entrepreneurs, as investors, this is something that's impacting our bottom line, and it's improving the health and well-being of our employees, which of course we know increases retention, it increases their productivity, and it increases outcomes in every step of the way. It also allows us to give a better option for them. But on the other side, on the medical side, they're getting better care. So it's a win-win opportunity. So now I'm going to ask the question. I've brought you together for a reason. You guys are both amazing entrepreneurs. You have complementary businesses. How do you balance the businesses and the work-life balance aspect of this? And then, so share how you keep it separate, and when you're at home and you're not on the clock, if you will. How do you manage to not have these conversations cut in? And then how are your complementary businesses working together? So how do you have the business conversation and keep the personal out of it? So kind of give me both sides of that coin, if you will.
Okay, I can start. Yeah, she's smiling, which means we don't.
Oh, the real deal here is behind the business.
Yeah, so it's very difficult to keep personal and business conversations because it gets into each other. But yeah, I mean, when we go home, and with kids, of course, naturally we don't think of those. But then occasionally, even while driving, we when we speak, we're like, oh, what did you think about this? So business is always in the back of the mind. When you're an entrepreneur, I know, for you as well, business is never outside of your consciousness, right? You always are thinking about that. So yeah, business is there, business conversations are there, whether it's at work or we actually work in the same place. I mean, we have the same office. So it's at work, at home. When I get some idea, then I just tell her, and then we start the discussion. So we have not been that good keeping it separate, but unless it kind of intrudes and it's not good, she makes it very clear to me, no, I don't want to talk about it. So now that's a signal to me to stop talking. And so until I hear that, I just go on.
So I think we have very different energies and very different working styles. I learned a lot from him. He's a natural teacher. He's a natural coach. And I suck up anything that the information I get from him and his work style, I try to incorporate it in mine. That's how I look at it. Because being a physician and being, when you work as a hospitalist, you're like all over the place. There is no order to the workflow of the day. So I basically like kind of trained myself into a lot of, I got a lot of information and knowledge from the way his work style is. But at some point it stops because it's like, okay, I have other things to do and I don't want to hate myself doing the other things. And I need to kind of like, okay, you're going through this, you're excited about something. I mean, if it's a good news, it's good news, right? But bad news, nobody wants it interfering. So if you have something unpleasant to tell me, I'm going to stop it right there and deal with it later because I need to take care of other things. So I learned to do that and it doesn't bother me as much. It's like you can go on and I said, I've got to do this, this, this. And then as I said, my sleep routine is like, I need to be turned off. So I cannot handle any hot discussions after like 9 p.m. in the night. So it's like I don't want to trigger my adrenaline at that time because I have to get up early, get the kids out of the house. So for me, I've learned to separate it out. I've learned not to, if he brings up something, I'm like, okay, that's fine, noted. Let me do my thing now, but I'll get back to that later. So I kind of deal with it like that.
Yeah, let me share what we do. So my husband and I both are very, very much like that. And you're right, it's blended. Because when you're an entrepreneur, and I want everybody to listen to this and pay attention to this. When you are an entrepreneur, you solve problems. It is who you are. It is a part of your identity. We can't turn off a part of our identity. Like, let's just be real. I want to be very crystal clear. We talk about work-life balance. It really is work-life integration and it's energy management. And so it's natural to always be blending the work conversation in because we're excited about what we do. Even when ish hits the fan and it's a bad day, we still want to talk about it because we're entrepreneurs and we would solve the problem. We solved the problem today. But what my husband and I do is we do CEO walks. So at the end of the business day, it's our physical boundary. It's number one, it's a walk. So you'll love this. We're walking, we're in nature, we're talking, we talk through our day and we walk like often at a park. So the first lap, we're all business. And the second lap, I'm like, stop, I want to listen to the trees. I want to listen to the birds. So I'm very much like you. I'm the one who stops the conversation because my brain needs to kind of shut down the browsers, if you will.
Yeah.
Yes.
And so I really like that you have your boundaries and, we can all learn from one another and set those. So if you're at home and you're listening to this and you're an entrepreneur, it's okay that there is a work-life integration. We can't help ourselves. We can't cut off a piece of who we are, but we can learn how do I establish the boundary? How do I say it in a way that doesn't put off my spouse or partner or my kids? And so it's a learning process. So I'm going to ask you guys, what's next? You have complementary businesses. You're moving in directions that seem to be converging even more and more and making a big impact in the world. What's next?
Yeah, so when I married him, I never imagined this will happen, but we are getting more and more entangled. Our businesses are moving closer and we are looking at expanding into, we are expanding actively into multi-state telemedicine and primary care built in with insurance models for employers. And that is exciting to me because before last December, it was not on my planning board, the multi-state primary care practice, but now it's a reality. So I am super excited about this.
How about you? How do you feel about this?
Oh, I'm very excited. So, and the reason for that is, insurance we were doing locally and in Texas, and now some of the companies that got our insurance, they have other offices in different states, and now they want to have the insurance for those employees as well. So now it was a natural expansion, as where the insurance goes, the primary care goes, and so we also, it's not just virtual primary care that we can do through Meridian Springs. We can also do in-office primary cares. It's a little more expensive in terms of the premiums, but then there's a whole network of these kinds of direct primary care clinics across the country. I would say almost about 4,500 to 5,000, close to 5,000. And so we know each one of them, we have networked with them. So if there's a primary care, a direct primary care in the zip codes in which the employees live, we can assign those primary cares as a home base, which we call the home base because they can go there zero copays, zero deductibles, and get the exact same model, which we can do it in Houston. So we are not limited by locations. We can do it any location. Of course, if it's a very remote or rural setting, we will go in for virtual. But otherwise, we can do the insurance plan, anywhere across 50 states. We are working on Colorado, we are working in Arizona, and we are working on one in California. And so, and that's how we want to expand. So our expansion is basically driven by the employers wanting employees in those zip codes to have the same kind of insurance.
Of course, and who doesn't want to have a win-win-win?
Yes.
A win for the entrepreneur, the employer, a win for the employee, and a win for the community, because our public health then improves because we've added access. So I like to leave action steps for our entrepreneurs. I have an assignment: connect with these two people and learn more, educate yourself about some of these options. But what would be your one tip for people who are at home listening and they're like, this is overwhelming? What is one thing I can do today that will move me forward? And it could be with regards to communication, boundaries, anything that we've discussed all day. I'm gonna start with you, Doc.
Well, get a good night's sleep and focus, and get a focus on your energy. That has multi-step influences. It will impact your diet, your personality, your capability of covering different things without feeling exhausted. So I think it's a personal tip, but it's also like a medical tip. But I think look at yourself, look at how you feel and how to fix things, starting with sleep.
Fantastic. And how can people reach out to you, Dr. Rao?
Well, our phone number is 281-826-1359, www.springsmd.com, and we're on all the social media platforms. Reach us out, text us, call us. Happy to meet you all at our office. We do a free meet and greet, so you can actually come out there and say hi to us.
Fantastic. And your tip for the day, Sunil?
So I actually have two tips. One is when we were talking about boundaries, and what I've learned is women are good at multitasking. We are not.
I wasn't going to say that.
So that's one thing I've learned after we started to interact in business, is like things I'm like, oh, I cannot do, she can do. Like, she can switch off one business mode and become a mom mode. I cannot do business mode and the dad mode. So it takes time. So that, but in terms of insurance, one thing is, don't let fear drive your health insurance choice, because that's what is keeping people kind of chained to a very dysfunctional system in this country. There are a lot of great options available out there, whether it's your individual, you can do DPC, direct primary care, or you can insurance-wise a direct primary care based insurance. If you're an employer, there's so many other options, self-funding captives, that you can reach out to a lot of great brokers that are starting to do that, or you can reach out to me. Don't let the fear keep you captive or chained. I shouldn't say captive, but chained to dysfunctional insurance. That's the one tip.
Okay, fantastic. And Sunil, how can people reach out to you so they can learn more?
Yeah, they can reach out. If you're on LinkedIn, you can look up my name, Sunil Vasisht, Sunil, last name Vasisht, or just go to my website, medprime.co, and go through the contact page and just message me through there. Or you can call Meridian Springs, and I'm available through them as well. So there are multi ways to reach out, and I'm very happy to come educate. If you're an employee, you want to know more about if you have your CFO that's interested in the captive model, how it can be implemented, I'm very happy to come educate about that and what options are available. Or generally, if you're an individual, I can tell you what other options are available, so that you can see much better than what is portrayed out there.
Fantastic. Thank you both for being here. I really appreciate you for adding such value to my audience. And you, yes, you, it is time for you to take action today, right now, not tomorrow, not next week, because then you learned a lot and didn't move forward. The knowledge is a small part of the equation. The magic happens when we implement something. So pick one thing you heard, whether it's on the personal side or on the business side today, and implement it right now. Because that's going to create the positive momentum that is going to grow our businesses, and that is what is going to impact everyone else in our communities. So without further ado, unfortunately, all good things come to an end, including this show. But the good news is we'll be back here, same time, same station next week. But until then, win today, win this week, and we'll see you next time.
This has been a Now Media Networks feature presentation. All rights reserved.